Good morning, good afternoon, good evening. I am Dr. Gunalan Pawade, Senior Scientific Coordinator for Avian Influenza at World Organization for Animal Health, WOAH Headquarters, Paris. It's my great pleasure to welcome you all for this webinar on global strategy for the prevention and control of high pathogenicity avian influenza for the year 2024 to 2033. This new strategy has been developed under the global framework for the progressive control of transboundary animal diseases. In short, we call it as GFTADS. And this strategy was coordinated by the GFTADS High Pathogenicity Avian Influenza Task Force in close collaboration with the Management Committee. So this webinar is a 1 hour, 30 minutes duration. And now we will start the webinar with opening remarks from FAO and WOAH. First, I would like to invite Dr. Thanavat Jensen, the Assistant Director General of Animal Production and Health Division and Chief Veterinarian of Food and Agricultural Organization of the United Nations. Dr. Thanavat, the floor is yours, please.
Thank you. Thank you very much, Gunalan, for introductions. Excellencies, distinguished representative participants, WOAH Director General, and also representative from our partner organization, ladies and gentlemen. Good morning, good afternoon, and good evening, wherever you are. On behalf of the Food and Agriculture Organization of the United Nations, FAO, I warmly welcome you to this important webinar dedicated to the global strategies for prevention and control of highly pathogenic avian influenza. In recent years, the rapid global spread of highly pathogenic avian influenza has impacted livelihoods, economies, food security, biodiversity, and has become a public health concern. There is an urgent need for coordinated and sustained action to reduce the burden of this disease. Highly pathogenic avian influenza or bird flu have long been a global priority under the joint FAO and WOAH global framework for the progressive control of transboundary animal disease, called GFTAD. In recent years, we have witnessed a shift of the dynamics of highly pathogenic avian influenza with multiple virus subtypes circulating simultaneously in several countries. Additionally, the increased spillover of the virus in wild birds and several mammalian species has raised further concerns, highlighting the urgent need for stronger prevention and control measures and the need to prevent at source. These challenges demonstrate why these revised global strategies is necessary to guide coordinated effort at the global, regional, and national levels in tackling the threat posed by highly pathogenic avian influenza through a holistic One Health approach. Ladies and gentlemen, FAO has been at forefront for avian influenza prevention and control for the last 20 years, since 2024. We have monitored highly pathogenic avian influenza risk via FAO global network of regional, sub-regional, and country offices and provided risk assessment and alert based on emerging trends. We have enhanced member capacities for highly pathogenic avian influenza surveillance, diagnosis, emergency preparedness and response, and convene global, regional, and national policy dialogues in the face of challenging risk. Over the year, FAO have deployed emergency response missions to over 50 countries. FAO and UNEP Conventions on Migratory Species established a task force in 2006 to protect migratory birds and biodiversity. And we have played our role in pandemic preparedness by sharing animal influenza surveillance data through the OFFLU, the joint WOAH and FAO scientific network on animal influenza. Ladies and gentlemen, this webinar marks the beginnings of a collective effort to address the upstream driver of highly pathogenic avian influenza transmissions, to enhance cross-sectoral collaborations, rapid information sharings, and a call the action to promote investment and stop bird flu at source. At FAO, the Committee on Agriculture Subcommittee on Livestock has mandated us to scale up biosecurity in value chain as a key focus area for upstream prevention of risk of the global health and food security. It is time to leverage a new global strategies and discuss next step at global, regional, and national level to advance its implementations. And today, together with the Director General of WOAH, I would like to acknowledge the long-standing partnership between FAO and WOAH under the GFTAT and reaffirm FAO's commitment to working with all stakeholders, including National Veterinary Authority, regional organizations, financial institutions, and private sectors partners to support countries in effectively preventing and controlling highly pathogenic avian influenza. And I encourage all of you to actively engage in today's discussions and collaborate in implementing these strategies for the more safe and resilient global poultry sectors and global food security. Thank you for joining us.
Thank you, Dr. Thanavat Jensen, for your opening remarks. Now I invite Dr. Emmanuel Zuberan, the Director General of World Organization for Animal Health, for the opening remarks. The floor is yours.
Thank you, Gunalan, and thank you, Thanawat, for your welcoming word. Dear delegates, dear national focal points, representatives from regional organization, partner organization, and private sector from all over the world, I really like to see all your messages of welcome on the screen from all over the world, and you are representing the world community of animal health, and it's very nice to be with you today. Thank you for joining this webinar on the new global strategy for the prevention and control of highly pathogenic avian influenza, as we address the pressing and evolving global challenges posed by avian influenza viruses. Since October 2021, the disease has caused the death of more than 300 million birds globally, affecting the livelihoods of millions of people. While historically confined to avian species, the virus is increasingly crossing the species barriers, impacting a wide range of domestic and wild mammals and causing devastating impacts on ecosystems. These developments pose significant challenges to animal, human, and environmental health. The Animal Health Forum on Avian Influenza, which was held during WOAH's 19th General Session in May 2023, convened key stakeholders and members of the organization to discuss on how to minimize the impacts of avian influenza across sectors. WOAH members adopted a resolution which outlines the recommendation for members and other partners to deal with the global threat of highly pathogenic avian influenza. The resolution notably underscores the importance of members respecting and implementing WOAH's international standards to effectively combat avian influenza. At the World Organization for Animal Health, our priority is to closely monitor the evolution of the disease and enhance global coordination for prevention and control by early response. To better understand and mitigate the risks associated with the spread of highly pathogenic avian influenza, our 183 members have an obligation to officially report the occurrence of the disease in animals via the World Animal Health Information System, which you know as WOAH. WOAH regularly updates its science-based recommendations, and we call on our members to take immediate action to strengthen and scale up surveillance in domestic and in wild birds, to stop animal-to-animal transmission by enhancing biosecurity and early detection system in poultry, but also in cattle and other livestock in high-risk areas, and take action in case of a positive result, and to transparently report all avian influenza cases, including in animal hosts other than birds, again through WOAH. We want to emphasize that, based on current knowledge, safe international trade in poultry is possible if the risk mitigation measures recommended by WOAH international standards are in place, and this includes the use of vaccination. In line with the One Health approach, this global strategy for the prevention of highly pathogenic avian influenza is a great avenue to strengthen the surveillance of highly pathogenic avian influenza in wildlife species. Today, it is World Wildlife Day, and as such, I want to emphasize how highly pathogenic avian influenza has been affecting or threatening certain wild bird populations, like the emblematic species of pelicans or flamingo or Californian condors. The virus has also heavily affected colonies of wild birds and marine mammals in sub-Antarctic and Antarctic areas, raising concern about sustainable management of wild, domestic, animal population interfaces. This global strategy presents the different areas of intervention needed, including rethinking certain production systems concentrated in wetlands and calls to mobilize and optimize resources for more efficient surveillance system of avian influenza virus in wild populations, increased sharing of information, strengthen prevention and control measures. The global strategy has been developed following an extensive consultation process at international, regional, and national levels, involving stakeholders from public and private sector, following thus a One Health approach. We will continue liaising with national veterinary services and producers of affected countries. If we work together, we can mitigate this global threat and safeguard the health of animal, people, and ecosystem worldwide. As the global community continues to face the challenges posed by highly pathogenic avian influenza, WOAH urged government, industry players, and relevant stakeholders to actively participate in the implementation of this strategy. In collaboration with our partners and with FAO, of course, and also WHO, we are fully committed to continue supporting our members through our scientific networks, partnership, and initiatives. I thank you very much, and I wish you a very fruitful webinar. Thank you.
Thank you, Dr. Emmanuel Subran, for your opening remarks. Okay, I think now we could move on. Karima, can you put up the slides? So before starting the webinar, we will take you an overview of the agenda points, what we will be covering in this webinar. So this webinar, as I told you, is presented under the GFTAT's HPAI task force, and you can see the members from the FAO and WOAH team involved in the first slides. and supported by the Global Secretariat of the GIFTAD. So you can see we have completed our opening remarks. The second session will be on the global challenge of HPAI from WOAH and FAO, followed by the revision of the global strategy for the current HPAI global context. This will be presented by our WOAH and FAO experts who are heavily involved in this revision or the new process of the strategy. And then myself and my colleague Ismaila FAO will present the actual presentation of the strategy, then followed by a panel discussion. So we have 3 panel discussion in the panel discussion, and each of the panel discussion we have a number of panelists who will be introduced during the actual panel. These panelists are coming from veterinary members or from the partner organizations or technical partners or public partners. And then finally, we will have the next steps and closing remarks from WOAH and FAO. So as you can see in the agenda, we don't have a dedicated question and answer session. What we recommend all the participants to input all your questions in the tab in the Zoom down below, question and responses, where we will try our expert task force as well as the experts will try to answer. For those that will not be able to answer, we will cover up and answer you directly. Okay, so now I hand over to moderate the next session to my colleague FAO, Dr. Ismaila Sheikh, please.
Yeah, thank you so much, Gunalan. Good morning, good afternoon, colleagues. My name is Ismaila Sheikh. I'm the Animal Health Officer in charge of One Health Intelligence and Early Warning, and co-sharing with my colleagues here, Gunalan, the HPAI Task Force under the GFTAD. I'm going to moderate this session that will really talk about the global challenges of the high pathogenicity of avian influenza. And for this, I'm inviting my colleague from WOAH and FAO, Dr. Gregorio Torres, the Head Science Department from WOAH, and Amy Delgado, the Senior Veterinary Advisor from FAO, to share them point of view on these topics. I know that FAO and WOAH have working actively on this support to control and prevent avian influenza, and through the different institutions, a lot of activity or a lot has been done, and that's the time for us to share with us some key challenges to really for this avian influenza. Gregorio, please, the floor is yours.
Thank you very much, Ismaila. I hope you can hear me well. And thanks, Guneland, and good day, colleagues. I see there are more than 600 colleagues connected today, so it's a great success. Thank you very much for this opportunity, and in particular for allowing me to share the WOAH vision on the global challenge that they are posed by the high pathogenicity avian influenza. As I already mentioned, the challenge that we are all facing has been defining the activities of both organizations in the last few years. And this new strategy is precisely designed to address these challenges. We have seen a significant change in the epidemiology of the disease. The virus has evolved, but also the geographical distribution, the seasonality, all has changed. And what is really important is this affecting a range of domestic and wildlife animals, including livestock. And that's bringing new challenge, new projects, new risks to the animal health, but also to the human health. What we have learned in the last few years is that conventional prevention and control measures, such as biosecurity, stamping out, moving restriction, they are still extremely important, but sometimes they can be insufficient. Sometimes they are not sustainable, and also sometimes are not accepted by society. All these challenges were discussed extensively back in 2023 during the WOAH General Assembly, where the 183 members, they passed a resolution. There's a resolution number 28 that is precisely requesting GFTADs, WOAH and FAO working together to enhance and improve the global and the regional effort to control avian influenza. And this new mandate is what is bringing us today to this webinar. During the next couple of minutes, I would like to highlight 5 particular challenges that they are more directly linked to the WOAH mandate. My colleague Amy will continue with some other challenges that they are probably more linked to FAO mandate, but obviously we will need to work together on that. The first challenge I would like to highlight today is the need to adapt and implement international standard. We know the WOAH plays a very important role in developing science-based international standard that they need to reflect the latest knowledge. This standard provides a global framework for countries to implement effective surveillance and control measures and to ensure that we are all working in a coordinated manner. With the support of our scientific community, we need to ensure that those standards are actually fit for purpose and reflecting the latest knowledge. But equally important is that we all need to ensure that our membership, our country, our stakeholders, they all have the capacity, but also the will to implement the standard. By doing that, this is the only way that we can minimize the risk of international spread, but at the same time ensuring that there is a safe international trade and therefore business continuity for the poultry sector. The second challenge I would like to highlight today is surveillance. We need to enhance surveillance, but also promote transparency. We know surveillance systems are critical for the early detection and also monitoring of avian influenza outbreaks. We need to establish a very solid public-private partnership to strengthen surveillance capacity at global level, but also to build this trust that is necessary among all the stakeholders. We do need to penalize those countries or those sectors that timely report disease to national authorities and also to WOAH. Additionally, countries should have the capacity to diagnostic, but also they need to have the infrastructure to detect and monitor the virus. We need to promote capacity building activities to enhance diagnostic capability at national and regional level. But also we need to facilitate the access of international scientific networks, such as the WOAH FAO reference lab network, but also to offload scientists that has proven critical in responding to the current risks. The fourth challenge I would like to discuss with you today is how to design effective control disease strategies, and that of course include vaccination. We need to make sure that countries have access to these cost-effective disease control strategies that at the time sometimes it might include vaccination. Control strategies should be evidence-based and need to be accepted by the society. We know that massive stamping out of poultry farms might not be sufficient to contain the risk and definitely are not socially acceptable. We should explore complementary disease control tools, including vaccination. And when countries decide to vaccinate, their strategy needs to be based on the current evidence and also tailored to the real and specific needs of that country. But importantly, countries that effectively use vaccination according to international standard, they should not be penalized by unjustified trade policies. The final global challenge I would like to discuss with you, to present to you today for further discussion, is how to promote intersectoral collaboration. Effective avian influenza risk management requires collaboration and coordinated effort from all public and private stakeholders. We need to engage the governments, we need to engage the industry, but also the civil society to ensure that there is a unified approach in the prevention and control of the disease. The complex challenge posed by avian influenza can only be addressed by fostering this cross-sectoral collaboration through the One Health approach, and that requires the integration of the animal, human, and environmental health. I'm very certain the global strategy we are presenting today will provide us with the adequate framework to address all these challenges and some of the challenges that will be presented by Amy in a second. And our Director General mentioned WOAH is totally committed to effectively implement this new strategy and collaborate with all of you to minimize the animal health, but also the human risk associated to avian influenza. And with that, I really thank for your attention, and I'm really looking forward for the discussion and importantly to continue our collaboration in the time to come. Thank you very much, Maria.
Thank you so much, Gregorio, for really providing all the WOAH perspective on the global to address the global challenges. I will now give the floor to Amy from FAO to share some perspective from FAO side. Amy, the floor is yours, please.
Yeah, thank you so much, Ismaila, and thank you, Gregorio, for laying those out so clearly, and certainly many shared concerns around those challenges and the need to collaborate and work together. Thank you to everyone for being here, for the opportunity to engage around such an important topic at such a critical time. I think we all recognize that avian influenza continues to have many cascading effects globally. From the FAO perspective, we've certainly seen those impacts on poultry producers, direct impacts on livelihoods and the economic burden that avian influenza can cause within communities, within small-scale production systems, as well as in commercial production and trade. We know that oftentimes the disease impacts can lead to decreased investments in things like biosecurity. And those decreased investments can lead to a cycle of risk, vulnerability, and further loss. And it really highlights the need for continued monitoring and continuous risk assessment, as well as strengthening biosecurity across poultry value chains. This is in part why the Subcommittee on Livestock within FAO, which represents member countries, recommended that FAO focus on biosecurity and improving the tools and the support to member countries in order to strengthen biosecurity, which eventually led to the development of the Progressive Management Pathway for Terrestrial Animal Biosecurity, which is a great tool to bring to bear in this time. But we also know that those cascading threats have included other things that have been highlighted this morning: threats to food and nutrition security. We know that in many areas, poultry are an important primary protein source, and that threats from avian influenza can lead to exacerbating food security in many countries. There are many wider socioeconomic impacts of avian influenza beyond just poultry production, other aspects related to the poultry industry, but certainly things related to nutrition in childhood nutrition and in school meals and those types of programs as well. And we've also heard about the threats to biodiversity. And we know that there have been extensive impacts in wildlife and bird species, many mammalian species, and many fragile ecosystems that have been impacted by this virus. And so it's only through working together that we can begin to mitigate virus circulation and spread in order to begin to reduce many of those impacts. But given the complexity of all of those changes and the ripple effects that come from transmission, it really highlights that there are a lot of challenges to work through together in order to address it. And so we see in many countries that managing risk at the source isn't as easy as it sounds. It takes a lot of efforts around surveillance and monitoring, laboratory capacity and diagnostics, effective vaccination programs, a strong preparedness and response system in place, all have to be working together in order to really confront such a dangerous disease. And we know that for many countries, they need help in building those capacities and being empowered to do that work. It is important to note that biosecurity and vaccination go hand in hand. You can't do one without the other. And within FAO, we recognize that holistic approaches are needed in order to really bring this disease under control. And we're excited to see that this framework offers an opportunity for those conversations and for that collaboration to move forward. Those multi-sectoral approaches are going to be so important in the next coming months, as well as in the conversations ahead, leveraging those context-specific solutions that are going to help diverse poultry systems to become more resilient, safeguarding those livelihoods and biodiversity at the same time. We also recognize the need to strengthen some of our collaboration networks, like OFLU, a scientific network, as well as our laboratory networks. And we hope to continue to see those grow and strengthen over time. So we at FAO have been partners in confronting HPAI, as mentioned before, for over 20 years. And we're excited to continue this partnership forward, both with WOAH as well as with all of you who have joined today. So we thank you for the opportunity to share. Thank you for engaging on such an important global challenge, and we look forward to the conversations ahead.
Wonderful. Thank you. Thank you so much, Amy and Gregorio for really the nice talking point that address and give perspective from WOAH and FAO to address the global challenge, and where we can see both institutions, they are really highlighted the work on capacity on surveillance, vaccination also that need to be considered. We have also all the evolution of the knowledge of the virus, including the policies part is really something important, addressing also the impact of poultry producer, that's really important, and also all the threat to food and nutrition security. The collaboration was highlighted. The One Health approach is really important, and you will see is something really addressed during in the strategy, and also the complexity and the challenges we are facing need really more collaborative approach, and to include all the different sectors, including the private sector. That's really important. Thank you so much, both Gregorio and Amy, for the good point you raised. Now I'm going to give the floor to Gunalan to the next session. Gunalan, the floor is yours.
Thanks, Dr. Ismaila. Okay, so now we move on to the next session, the revision of the global strategy for current HPAI context. So you can see this slide, the names of the consultant team who helped us right from the start until the end of the publication and release of the strategy for this global strategy. So I would like to thank all these consultants on behalf of everybody and GIFTAD team for helping out on this task. So in this consultant team, I invite Dr. David Swain and Andrea Ellis for presenting a joint presentation on this topic. David, the floor is yours.
Thank you, Gunalan. So next slide, please. Sort of as a little background, when we began this process, that is in 2008, with the implementation of the first global strategy, we had some very specific things that we knew scientifically that were evident. First is up to that date, we'd had 28 high-path avian influenza events from distinct viruses. And the vast majority of these were the result of an emergent high-path virus that was derived from a mutation in a low-path H5 or H7 virus. And most countries at that time were able to face these emergent high-path viruses with a combination of biosecurity, surveillance, and stamping out programs, leading to eradication within a few months to a few years. But also in the backdrop of this, we had the emergence of a new virus that had a different biology, that had a changed biology from what we were facing in previous times. This virus appeared in 1996 and became entrenched as an H5N1 virus lineage in poultry, was spread in 2003 within Asia, and then in 2006 it had crossed into Europe and then down into Africa. What was new about this virus was we saw some infections of a variety of species of resident and migratory birds, although limited in the number. We saw infections in some mammals, mainly cats like tigers, that were fed infected poultry. And we started seeing these sporadic human infections, mainly from exposure through the live markets. Next. But what has really changed has happened over the last several years, all the way up to 2025, to the date we are facing today. And we've seen the expansion of high-path AI events from the 28 in 2008 to 51 distinct virus lineages and events that we faced up through this month. We've also seen an expanding global epizootic with increasing metrics, over 47,000 outbreaks, 47 million deaths in domestic as well as wild birds, and over 612 million domestic birds culled and disposed of. And within this one lineage, the H5N1 Goose Guangdong lineage, we've seen 5 intercontinental waves of spread, especially most devastating in this lower graph. You can see the very long time, the 4.5 years that we've been facing this 5th wave of intercontinental movement, including spread to North America, South America, and Antarctica. Next. In this process, we've seen global expansion in high-path AI affecting over 124 different countries and regions. We've seen extensive mutation in the hemagglutinin gene, which has generated multiple hemagglutinin clades and subclades, with one huge issue of extensive mutation of that hemagglutinin that has resulted in vaccine resistance and ongoing process needed for updating these vaccine strains for them to be efficacious in use in the field. We've also seen extensive reassortment of the goose guangdong virus with the other 7 gene segments with low-path AI wild bird viruses generating multiple genotypes. And these also have multiple unique biological features. For example, the B3.13 in North America that's caused infections in dairy cattle. Next. So this virus, we've seen the 2344B hemagglutinin clade has spread from its initial identification in 2020 in Central Asia to Europe and Africa in that year, then into North America in 2021, South America in 2022, and Antarctica in 2024, leaving only Oceania, Australia, New Zealand, and accompanying island nations to be free from this devastating virus. It's caused infection in diverse wild and domestic bird species. We're over 528 species, 51 families, and 20 orders. It's been spread by migratory as well as within resident wild bird populations with spillover and maintenance in various poultry operations across multiple countries. Spillover to our pet animals, our dogs and cats from predation on wild bird carcasses, and even in cats in the United States from consumption of infected milk or even poultry meat. Next. You spill over to 40 species of terrestrial mammals and at least 13 species of sea mammals with large die-offs and harbor seals in North America in 2022. And more devastating has been the die-off in sea lions in 2023 and elephant seals in South America. It's affected farmed mammals. For example, we've had 43 farms of fur animals in Spain and Finland that have been affected and depopulated. In the United States, most recently, beginning in 2024, we've had over 976 dairy herds affected by this virus in 17 of our states, and including expansion and infections and kind of rare cases in goats and pigs and alpacas. We've seen an increase in the sporadic human cases, mostly from direct occupational exposure. And we've also seen a negative impact on food supply globally, as well as increase in cost to consumers. Next.
Great. Well, thank you very much, David. I'll continue from there. So in terms of giving you a better sense of how we revise this strategy, our aim was to be as, in terms of inputs, was to be as inclusive as possible and understand really the complexity of the impacts of this virus in different contexts. As David has described, there's a very long history of avian influenza that has affected many countries. And so there were lots of lessons learned and experiences and a large body of research to take into consideration when revising the strategy. In addition to the insights from the global meetings that were held that were described in the opening remarks today, we also conducted regional surveys, stakeholder mapping, and had discussions with our regional secretariats of WOAH and FAO to identify some of the continued challenges and capacities needed. And we also drew on the work of standing groups of experts and other regional discussion groups or organizations to better understand some of the regional concerns. In addition, importantly, there was this scientific statement regarding avian influenza in wild birds, which also highlighted the impacts on wild mammals, which really helped to emphasize the need for strong inclusion of the wildlife health sector. Some of the common themes that arose from these inputs were, again, the need for a strong holistic approach, multi-sectoral approach, consideration of the socioeconomic and environmental factors that contribute to the spread, and the need for sustainable approaches to poultry production. Next slide. For the consultation process, once we had a first draft, we first did an internal consultation to draw on the expertise of our WOAH and FAO colleagues to be able to get their inputs, and we had a lot of excellent feedback. And then we went to an external consultation where we sought input from veterinary services, NGOs, private sector, other global organizations, and other regional partners, as well as scientific institutions. We greatly appreciate the input that we received and the thoughtful and helpful comments from 67 organizations coming from all regions of the world, mainly from national authorities, government authorities, and scientific institutions. So through this two-phase consultation process, we aimed to address some of the areas where there were still gaps, as well as to identify opportunities for how to better tackle avian influenza moving forward. And so even through this whole development of the process of developing the strategy, we once again saw that avian influenza was constantly changing, full of surprises, making the need for this global strategy even more important. And I'll turn it back to the moderators. Thank you.
Thank you. Thank you, Dr. David and Dr. Andrea, for updating us on these reasons and causes which necessitates for the development of this strategy, and also the methodology, what we use to collect the inputs for this development of this strategy. And once again, I want to thank all the consultant team for involvement in the development of the strategy. Okay, now we will move on to the next session, which is the presentation of the strategy. So myself and Dr. Ismaila Sheikh from FAO will give you a joint presentation on this strategy. So next slide, please. So as you can see, the HPAI global strategy covers a 10-year period from 2024 to 2033 for the next decade, with a midterm review to evaluate and update the strategy. So the goal of the strategy is to substantially and sustainably reduce the impacts of HPAI on poultry, improve the resilience of poultry agri-food systems, safeguard ecosystems, and protect animal and human health. So you can see from the slide that what is the vision? A world with effective HPAI prevention and control along poultry value chains that supports protection of humans, other domestic animals, wildlife, and the environment, and aligns with the sustainable transformation of agri-food systems. So you can see the scope of the strategy. The scope takes into consideration all HPAI, especially the now predominant clade H5 2344B clade, and also other clades of the goose gangdong lineage that affects poultry, wild birds, and other domestic and captive birds, and also the spillover to humans, livestock, and wild mammals. Also, this strategy is also relevant for the zoonotic LPI events like H9N2 in poultry, where the measures can significantly reduce disease burden. Therefore, this strategy covers the domestic animal health sector component of a wider One Health approach for the prevention and control of HPAI, and complements other strategies, such as the strategies from the human health sector, the WHO global influenza strategy, the strategies from the environmental sector, including wildlife health, and the scientific task force on avian influenza and wild birds. So the primary target audience of this strategy, you can see the list, the primary target. It is relevant for the national veterinary services, wildlife, environment, public health services, regional economic communities, private sectors, research educational institutions, civil society organizations involved in animal health, welfare, production and value chains, and zoonotic disease prevention and control. Next slide, please. So the strategy identifies 3 objectives that are all interlinked and necessary to achieve the goal of substantially reduce the impact of HPAI on poultry and other domestic animals. So you can see the 3 objectives are prevent, protect, and transform. So prevent HPAI epidemics, panzootics, and the negative impacts on biodiversity through multisectoral yearly detection and control. Protect is the protect poultry value chains, livelihoods, trade, and the health of humans, ecosystems, and other animals from avian influenza impact. Transformation means transform the poultry value chains to improve resilience to avian influenza and other disease threats. So the key themes of the strategy are prevent, protect, and transform. So the prevent is focused on strengthening the systems and capacities to ensure timely detection and information sharing, and the protection emphasizes the actions to protect poultry from HPAI infection through strengthening the use of effective tools And transform reflects a broader vision to ensure viable, safe poultry production. Okay, now I give the floor to Dr. Ismaila to continue.
Yeah, thank you. Next, please. Thank you so much, Gunalan, for the presentation, giving the overview, like the vision, the goal, and also the target audience of this strategy. As you can see, as presented by Gunalan, the strategy will focus on three main objectives: to present HPAI, HPAI episodic, panzootic, and negative impact on human health and also ecosystem through multisectorial collaboration and for early detection, to protect poultry value chain, livelihood, trade, and also health of human, animal, and ecosystem from HPAI impact, and the transformation part on poultry value chain to improve resilience of HPAI and other disease threat. That's really important to highlight. This is a high-level theory of change, and the theory of change is will show in details in the strategy, where you can see you have a lot of relation between the outcome and the object and the output from the protection part, who will address the prevention part. When we talk about biosecurity, we have a cross-cutting output there and also outcome, and also that is we have a cross-cutting output and outcome addressing prevention to transformation to protection. That's just a high-level theory of change that will help you really to understand how the strategy is really designed. Here, what is important for now is really, after going through the different vision, objective, and also the goal of the strategy, it's important to see what are the key action needed for to address, implement, or to achieve that vision at global level, at regional level, and also at country level. At global level, the key action needed is at first to have this governance structure. It's really important to know under the GFTAT mechanism how we can establish that structure to be sure that they will have enough structure or institution ready to support the operationalization of the strategy and help us really to achieve really the vision. And the engagement of partners is really important. As you know, here we are having in the panel session the invitation from colleagues from the private sectors, and it's important to know that this strategy to achieve the vision is important to engage different partners with other sectors and also including the private sectors. As you know, one of the key strengths of this strategy is the communication plan. You know, the difference between the last strategy is that we would like to have a clear communication plan at global level, starting from the launch and now the release of the strategy today, to communicate at regional and country level more, and also to more share through the different stakeholders and networks the strategy for people to be able, and region and country to be able to take it, adopt it, and also use it. A clear communication plan is important, and using our existing network. And in the speech of opening remarks from our directors, we highlight the role of OFLU, encouraging country to share data on HPAI, to use that network, the scientific network, to really better assist and support country on the new changes and how information can be used to adapt and customize the different existing prevention and control plan for HPAI. As you know, it's not only developing a strategy. We need also to develop some guidance and having some standards to facilitate the creation of the control of the strategy, and including HPAI vaccination program. You know, this guidance and standards will help us to really better support the country, and having some reference to really, if they would like to establish some vaccination program, what are the different steps, what are the different requirements really to establish that one, and also having some guidance on what is required in the vaccination campaign, what is required in prevention and control strategy to be operationalized. we all agree that the One Health approach is key. It's one of the assumptions of the strategy, and using also the quadripartite with other partners is really important if you would like to operationalize this strategy using the One Health approach. One thing is really also important, the Sustainable Livestock Initiative is, under this strategy, you can see we have prevent, protect, and transform. This transformation part is really important to make sustainable all the livestock initiatives, because they will help to make more resilient the producer, resilient all the different actors along the poultry value chain, and that will help also to support region and country to strengthen poultry value chain and enhance this resilience I'm talking about without any reducing the impact of the disease. Next slide, please. At regional level, we really see one of the main action is still, you can see the communication is still here to facilitate the dissemination of the strategy and the development of HPAI action plan, to take that strategy at regional level to organize another different communication channel to share that strategy with the country and the different stakeholders, and turn it into action plan at regional level to better support regional initiative and also the country. We need also engagement from regional economic communities, where really with the GFTAT regional steering committee and other networks to establish some cross-border collaboration and really use the existing network to really more share and communicate with on this strategy involving really the regional economic community. We talk about also the implementation of the strategy is important at regional level to assist member state, to assist our counterpart to really implement the strategy, establishing regional economic, regional networks, establishing regional action plan can help them really to build on that one and to adapt it into national action plan. The One Health also is something cross-cutting at global and regional level to encourage collaboration with regional quadripartite partners, to regional to all regional partners existing at sub-regional and regional level, to involve them using the multi-sectorial approach. We have also the information sharing to promote regional and update information on HPAI context. I think it's really important, as you know, from different region, from different sub-region, we have different context of HPAI, and this strategy needs to be contextualized from the different sub-region and region, and sharing the information existing will help really to update and promote regional colleagues to update and sharing this this strategy. What is important also is the development of some existing laboratory network. As you know, the weakest part of the strategy was all these new challenges, the new epidemiological situation we are seeing. It's sometimes difficult really to connect with the different subtypes circulating from different regions, and this laboratory network will help really to facilitate and share all that information connected with our reference lab to really provide enough information to the country to know what are the different subtypes circulating and how that can be customized and adapted for customizing the strategy at regional and also at national level. It's important also what is to identify key area where we can engage stakeholders, where we can really identify crucial area where we are talking about the transformation part, where these things need to be addressed to really be sure we are having this sustainable livestock transformation, building on the resilience of the poultry sectors. Next slide, please. At national level, it's important really to turn the regional action plan into national action plan. It's really important, and for this to get some guidance and also from the global strategy. The promotion on the reporting and sharing information is really important, and the timing information sharing and the transparency is really important from the low and the high pathogenicity of avian influenza, and including the genomic data where the network, the laboratory network is playing a key role, and link it with some reference lab of WOAH and FAO, and here using the offload network can really be very effective and helpful for the country. The laboratory capacity, the diagnostic part is something really important, and to build also enhance the capacity and to equip the different laboratory for the early detection and response. It's really something important. We have the collaboration at regional level where the different partners through the GFTAT to share experience, data, and also discuss on challenges and progress at national level. The action plan, you will see after when we will present the next step, we have that opportunity to do a midterm review where the progress will be monitored to know what are the different level of implementation. We are really moving on still the collaboration, the One Health collaboration to engage from the national One Health platform, because in some country, you know, that is that involve many sectors, the public, the animal health, the environmental side, and also other sectors on the collaboration to better support the control and the prevention of the HPAI at national level. The advocacy is really something important to seek to the political and financial backing for HPAI prevention and control. If at national level HPAI is not a priority, I think it's going to be difficult really to address that one. That's why the advocacy is really important to have this political support, and also how they can also support the prevention and control plan implementation at national level. We have also important point need to be conduct the after action review, where really we are reviewing the post HPAI outbreak. We have a lot of, in some regions and countries, a lot of outbreak ongoing or happen that really without any after action review to know what works well, if we have enough the planned action plan that was designed at regional and national level works well or not. It's important to do this active action review to identify the gap, what need to be strengthened, and how they can really be addressed. And here you have the next step for the implementation that I will leave to my colleagues Gunalan to go through the different steps we identify to implement this strategy. Over to you, Gunalan.
Thanks, Dr. Ismaila. So this slide, you can see the timelines. What's the next steps in the implementation process of the HPAI global strategy? So already the step 1, the global HPAI strategy was launched in May 2024 during the margins of the WOAH general session to all the members and different stakeholders, where a brief version of the strategy was launched. At the time, we don't have the full strategy released. So now you can see the step 2, a week before, the full strategy was published. So that was published, and now we had a webinar ongoing now to inform the members and the stakeholders. And we will move on to the step 3, where the release of the strategy, we will discuss with the regional engagement and consultation to operationalize this strategy. And then based on this regional engagement, the step 4, where the countries can utilize this global strategy to develop or revise their national HPAI plans and then on go for implementation. So, and the midterm, so this is a 10-year strategy. So we will have a midterm review because the avian influenza situation is an evolving situation. So we want to review, have a midterm review, what's happening. Based on this, we will try to review and update this there. And that, as Dr. Ismaila told, at the strategy end term, we will have a final review and next steps. So with the goal, keeping in mind, we have to want this HPAI prevention and control supports protection, prevent the humans, domestic animals, wildlife, and the environment. So over the period of these 10 years, there will be yearly monitoring of the impact of the strategy implementation by engaging fully with the regions and also at the national plans to support from us. Okay, we move on to the next session, and I hand over to the panel discussion. So I will hand over first to Dr. Ismaila to conduct the first panel discussion.
Yeah, thank you so much, Gunalan. Now we are moving to the panel discussion. And for the first session, where we are inviting representatives from the veterinary services of members country and representatives from regional organization, I'm inviting Dr. Yves Boussini, the head of the Animal Health Unit at the Inter-African Bureau of Animal Resources at Africa Union, to activate his camera. I'm going also to invite Professor Wulei Li, Director of Avian Disease Surveillance Laboratory from China Animal Health and Epidemiology Center. Dr. Wulei, please, can you activate your video? Thank you so much for really your interest to be part of this panel session. I will start with Dr. Yves from African Union. Please, I have two questions.
Yes.
For the success of this strategy, do you think it is important to have regional contextualization of this strategy? And how do you see the coordination between country and regional partners?
Thank you very much, and good afternoon to all. First of all, I would like to appreciate the invitation provided by FAO and WOAH to inviting AUIBA to be part of this panel. First of all, I would like to say that poultry sector in Africa is one of the most growing sector. And this sector is dynamic and integral part of national economies in most of the African countries. But since 2006, the poultry industry in Africa was experiencing transboundary animal disease, mainly Newcastle disease, but also avian influenza. And recently, AUIBA organized a continental conference involving all the 54 member states and regional economic communities to prioritize animal value chain. And 2 regions in Africa have prioritized the poultry sector as the most animal value chain to consider in the agri-food system in Africa. This is ECOWAS, West Africa, and Central Africa. And now to come specific to the avian, so we are grateful to WOAH and FAO for developing this global strategy for the prevention and control of avian influenza, because it's the avian influenza still one of the prevalent diseases affecting poultry sector in most of African countries. And the specificity of Africa is that we have 2 predominant systems, the village poultry and also the commercial poultry, and both are affected. So for the strategy, the success of this strategy will rely on cascading the global strategy to regional, to continental level. I know that for you, Africa is a region, but for us at continental level first, and then cascade it now to have a continental framework for avian influenza in line with the global strategy, which will also be cascaded to regional economic communities as well as national regional communities. Because from the past experience, there were in 2006, WOAH and FAO developed what's called this National Avian Influenza Action Plan, as well as also the Regional Avian Influenza Action Plan. And we would like to rely on FAO and WOAH to have the same mechanism in place and emphasize on the regional approach in disease in transboundary disease control in general, but in particular on for avian influenza. Thank you, and over to you.
Thank you so much. I think only one point: the coordination between country and region. How do you see that one? 1 minute.
Yes, I mentioned that to consider the regional approach in the control of TAD, because the specificity of Africa is that also most of the regional economic communities have specialized institutions in charge of animal disease control, like the Regional Animal Health Center for Central Africa based in Jamena, the Regional Animal Health Center for West Africa based in Bamako, the IGAD-ICPAL for Eastern Africa, and the Livestock Technical Committee for SADC. And coming from ECOWAS region since 3 years now, under the leadership of AUIBA, with the resurgence of avian influenza in West Africa, together with FAO and WOAH, an incident coordination group mechanism was put in place, and it is still in place, involving WOAH, FAO, and member states, and led by ECOWAS. Thank you.
Okay, wonderful. Thank you so much for the regionalization, the contextualization, or the continentalization of the strategy. It's really well noted, and also the mechanism that bring coordination between the continent with the sub-region and the country. Thank you so much for
also globally
for your question. Thank you so much. Now I'm going to the Professor Wulay. Please, I have one question, and sorry, we are a little bit late. We have 5 minutes. Okay, please. Do you consider it important that countries align their national plan to the objective of this strategy?
Okay, thank you. Good afternoon, everyone. I'm very happy to join the webinar and answer the question. Of course, countries' plan plays important role to the global control strategy on HPAI. Different countries may have different challenges and incursion pathways, but they need to align their national plans based on the global framework, especially on the current global spread situation and the One Health approach. For example, China has developed a comprehensive prevention control strategy for HPAI in accordance with the global strategy, which may differ from other countries. In particular, China has implemented a compulsory vaccination policy for all poultry against HPAI. Surveillance shows that the antibody qualification rate in poultry has remained above 90%, forming an effective immune barrier. This is the main reason why China has maintained the unique stability while frequent outbreaks have occurred internationally in recent years. In addition to the compulsory vaccination, China has also implemented other measures, like including monitoring and early warning, improved biosecurity, emergency response, stemming out with compensation, movement control and quarantine, regionalization management, including disease-free zone and compartmentalization. These measures cover all links of the entire poultry industry chain, from breeding, transportation, slaughtering to marketing. So it can be anticipated that with the effective implementation of the measures, the risk of the large-scale outbreaks in China remains lower. But notably, scientific and technological innovations also has played a significant role in disease control. For example, we maintain the advanced vaccination development technologies, and a dynamic system for timely vaccine update. So in summary, aligning national plans with the objectives of the HPAI strategy is essential for effective disease control, global coordination, and sustainable development. It ensures that efforts are comprehensive, context-specific, and supported by the international collaboration. That's all. Thank you.
Thank you so much, Professor Wolay, and also Dr. Iver for informing and giving us some good feedback regarding the adoption and the contextualization of this global strategy at regional and country level. I think I'm moving now to the next session that will be presented by my colleagues, moderated by my colleague Gunalan. And yeah, Gunalan, the floor is yours.
Thanks, Ismaila. So we will quickly move on to the next panel discussion. We are running shortage of time, so we'll go quickly. For the next panel discussion is we invite representatives from partners. So you can see here we have 4 panelists: Dr. Bernard Van Kotham, President of the GIFTAD and Director of Crisis Management in Food, Animals and Plants from European Commission. We have Dr. Coran Moore-Koster from Animal and Plant Health Inspection Service, who is the Associate Deputy Administrator from USA. And then we have Dr. Varia Mankerho from Director Epidemic and Pandemic Threat from WHO. And then we have Dr. Ruth Cromie from CMS, appointed a scientific task force for wildlife health. Okay, so can we, so we have all the panelists in one frame here. So first, I will go to Dr. Bernard Van Kotham. So you have, because of shortage of time, sorry, I will give like 2 to 3 minutes. If possible, you can give your feedback. So first question to Dr. Bernard Van Kotham. For the success of this strategy, do you think it is important to have regional contextualization of the strategy? The floor is yours.
Yes, thank you. I'll try to be extremely short in the interest of time. I mean, we all know that HPAI effectively requires a sophisticated strategy because of the disease crosses the border, spread throughout wild bird movement, and that's a challenge for all of us. So we do not need only national effort, but we need a comprehensive global strategy. But yet a global framework alone isn't enough. Regional contextualization is crucial for success, and you have highlighted that. HPAI spreads differently worldwide due to different factors: wild bird migration, I mentioned that, seasonal variation, and trade route. Human activities, local awareness, and technical capabilities of laboratory also, of course, influence its spread. This variation makes one-size-fits-all strategy impracticable. For example, poultry production systems vary widely in some regions, focusing on chicken in one region or on other waterfowl in other regions. So that's why we need really tailored locally biosecurity measures and vaccination strategy. Moreover, differences in intra-regional trade pattern and biosecurity practices highlight the need for regional strategy. And while the global strategy offers a unified framework, regional adaptation tackles specific local challenges more effectively, considering each region's economic and practical realities. And we see that with the representative from Africa a couple of minutes ago. Regional partners are pivotal, acting as coordinators to ensure that diverse local strategies align with the global strategy. And the organization like GFTAD has been instrumental in coordinating regional effort, as we have seen in the eradication of lumpy skin disease in Europe. They ensure that while respecting regional differences, the broad aim of controlling the pandemic remains intact. In conclusion, I'll be short, while the global strategy provides overarching goals, regional contextualization ensures effective implementation. This adaptive approach respects local variations while working toward a unified global objective, maximizing effectiveness and fostering collaborations that are key to control HPAI worldwide. Thank you.
Thank you, Dr. Van Gautam. So I think it is important to have the regional contextualization of the strategy also. So now I move on to the next panelist, Dr. Coran Moore-Custer. For you, the question is, from your national perspective and experience as chair of the regional GFTADs, will it be challenging and what kind of support will you need?
Thank you, Gunalan, and good day, everyone. Yes, it will be challenging. No single country can successfully accomplish the bold collective vision articulated by this plan alone. Some of our challenges will include resources, coordinated action, and knowledge sharing. And those resources are limited, even in high-income countries, and those can include but aren't limited to personnel resources, financial resources, technology, diagnostics, and supplies. Coordinated action is a challenge. Each country has various and sometimes conflicting authorities, multiple stakeholders with varying sector-specific risks, varying disease statuses, priorities that constantly change, differing country-specific risks and risk tolerance levels, and socioeconomic considerations, including food security challenges. And sharing knowledge can be difficult, and that can be because of proprietary information, language and culture barriers, and political considerations. Our collective vision will require economic, scientific, producer, and governmental support, as well as enduring and effective relations with our public and private sector partners. Those economic support considerations include fostering investments, fair and equitable indemnity, sustainable and circular bioeconomies that incentivize positive change. Scientific support will include laboratory infrastructure, timely detection and risk-based surveillance systems, proper vaccination. Producer support will include appropriate stewardship approaches, good production practices, and vigilant biosecurity, as Dr. Delgado outlined for us earlier. Governmental support will include advocacy to mobilize national resources, intergovernmental communication, timely information sharing, rapid coordinated intersectoral responses, and zoning and compartmentalization. And lastly, the partnerships and network support needed will include national veterinary services support, wildlife, environment and public health services, laboratories, national One Health partners and sectors, international and regional organizations, as we've heard outlined earlier, economic communities, private sectors, research and educational institutions, and last but not least, civil society organizations involved in animal health, production and value chains, and zoonotic disease prevention and control. Thank you so much.
Thank you, Dr. Karan. So I could see the various challenges well noted, and I hope we will find the solutions as we progress on the implementation of the strategy. So now we move on to WHO and CMS. So these panelists, they have the same question. So first I will give the floor to Dr. Maria. The question is, HPAI is a typical One Health global issue. This strategy is primarily addressing the animal health component, but this cannot be done in isolation. As quadripartite partner, how do you see your role to support the strategy and foster a One Health approach at national level? Over to you.
Thanks, Gunalan. I know you guys are running late, so I will be very brief, but I just want to say how happy we are to see this global strategy published. Absolutely what you said, using a One Health approach, no one sector works alone. But the detail that you have in here looking at preventing, protecting, transforming is really taking a comprehensive approach of addressing this in the animal sector while taking into account the challenges that countries will face in actually implementing. particularly keen on the global collaboration that we have across WOAH, FAO, UNEP, and WHO, addressing high pathogenic avian influenza, which has had this massive epizootic across the globe. We at WHO, of course, are looking from a public health perspective and making sure that we are preventing the next outbreak, epidemic, and pandemic, but cannot only look in the human health sector alone. That's actually the question I get. How do you only look at the human health sector? And of course, we don't. And so I'm very happy to see this strategy outlining in such detail how to tackle this challenge that you face. I can give you one example. We do this for pathogens with epidemic and pandemic potential, but for influenza, for example, and what this strategy is focusing on, particularly avian influenza, there is a global system that's in place that we do with partners all over the world, with the animal sector, with the environmental sector, looking at domestic animals, wildlife, coming together through the Global Influenza Surveillance and Response System, but also working very closely with you on off-flu and sharing of samples, sharing of specimens, sharing of sequencing, sharing of information for action. The sharing of that information, the specimens, the genomic sequences, the metadata are used for characterization, they're used for risk assessment. And last week, the global expertise came together at the vaccine composition meeting to make recommendations for seasonal influenza vaccine composition, but also to recommend new candidate vaccine viruses for avian influenza. And this puts the world in a much better place in this interpandemic period to get ready for the development of vaccines as one intervention. So that sharing of information is happening constantly. What I am really thrilled about within this strategy is that you're looking at the drivers of why this is actually happening, and you're really tackling the incentives and the disincentives, working across the different sectors, working with industry, working with farmers, working with people and communities. And I think that's really the biggest challenge that we face right now. So you have partners in us always, no matter what, but always, particularly in the implementation of this. And WHO will be very happy to work with you, with member states, with national, with subnational entities to make sure that this strategy is actually implemented and it reaches the goals that you've outlined in the document itself. So congratulations on publishing this. Over.
Thank you, Maria. So now let us hear from Dr. Ruth Cromie.
Thank you very much, Gunalan, and thank you for inviting me to speak today. I'm speaking on behalf of the Convention on Migratory Species, which is an environmental treaty under UNEP, which is obviously one of the quadripartite partners. There are 133 national parties to the convention, and I suppose we have heard quite a lot today about the conservation consequences of this particular wave of H5N1, which of course is coming at a time which is really exacerbating the current biodiversity crisis. I suppose there are two areas of activity for the Convention on Migratory Species which in effect already support the strategy. Firstly, via guidance, which mainly comes then from the Task Force on Avian Influenza and Wild Birds. That task force is co-convened by CMS and FAO, and that is guidance for parties and for other stakeholders. But there are also obligations for parties to CMS from adoption of resolutions. For example, our one that we had in COP14 last year, which is Resolution 1418 on avian influenza. And that really focuses on trying to reduce risks from trade, livestock, high-risk activities such as grazing of ducks in wetlands, the real importance of protected areas and reducing other pressures, taking other pressures off wildlife, the importance of planning and preparedness, and to not respond inappropriately, not to be killing wildlife and not to be damaging habitats. But looking forward in terms of how we can support the global strategy, then I think our continued focus on One Health issues and particularly on HPAI is very valuable. But there are other national needs which, recognising that our obligations under CMS represent soft law. So I think if there is other reinforcing of the following points from other bodies as well, I think that would be valuable, which is mainstreaming the importance of resilient and protected ecosystems, and that then really reduces risks across the piece. That cross-sectoral multi-stakeholder planning and preparedness with a one of those key objectives being about prevention and control in wildlife, and that will probably require national HPAI wildlife contingency plans. And then that full engagement of the environment sectors of government to deal with the wildlife issues arising from HPAI, and that active encouragement then from those agriculture sections to create that collaboration. And then I think when you've got those joint plans and that true sort of collaboration, that's when you get your good One Health approaches, and that's when you start realizing benefits then to all of the sectors. I will leave it there. Thank you.
Thanks, Dr. Ruth. So I think we all agree to wrap up this session. I would like to thank all the panelists. So we all agree that multi-sectoral collaboration and multi-stakeholders involvement through One Health approach is a key for tackle this avian influenza threat. So now we move on to the last panel discussion, and I hand over to Dr. Ismaila to take it through.
Yeah, thank you so much, Gunalan. We are at the end of this panel discussion session. I am inviting Julian Metley, Director General of the WOAH organization, Karel Dumarchi Sarvas, Executive Director of Health for Animals, and Nicolo Sinonti, Secretary General of the International Poultry Council. Please, can you activate your video? And we are at the end of this panel session. I will have one question, and I will ask each of you to. In 3 minutes, if you can really address that one. I will start with Julian, Karel, and also after Nicolo. The first, the question is coming from the private sectors. We are all from the private sectors. What are, from you, the main quick win and challenges for the success of this strategy, and what can be the role of the private sectors to support it? Can you start with Julian on that? And after Karel and also Nicolo. One question to be addressed from different angles, please. Julian.
So thank you, Ismaila. Thank you for inviting us to join the panel today. And thank you to WOAH and FAO for your leadership through GFTADS on this valuable strategy. World Egg Organization represents egg farmers big and small around the world. And we think about our work through the One Health approach and strengthening collaboration with the quadripartite organizations. For many years, World Egg Organization has been championing effective biosecurity as a very important tool in the control of AI, and will continue to do so. And this includes developing practical resources and biosecurity tools to be used on the farm. And our aim is that all of these on-farm tools are complementary to the work and strategies of GFTADS, WOAH, and FAO. We've seen that robust biosecurity protocols and controls can reduce the risk of disease and are very important. But we've also seen that egg farms with excellent biosecurity have still suffered from outbreaks. And so that's why we believe that egg farmers need another tool, and now that egg farmers need proper access to effective avian influenza vaccination programs as an additional tool. We're very pleased that the role of vaccination is comprehensively included in the GFTADS strategy, and thank you to Dr. Soubiran for reinforcing that today. All the time aware that vaccination in laying hens is a complementary measure to biosecurity and other control practices. And we recognize that the significant challenges regarding the impact on other sectors, the poultry industry, trade, and that a coordinated global approach is needed, supported by clear guidance on surveillance and appropriate steps to mitigate trade implications. And so for us, as more and more countries around the world start vaccinating laying hens against avian influenza, we think we must establish global best practice guidelines. At a farm level, this is something that we're already working on and are certainly happy to share our work and ensure that it's complementary to the high-level strategies developed by GFTADS. So we commend GFTAD's strategy for clearly and openly identifying and communicating the need for AI vaccination in laying hens as one of the tools, and we ask quadripartite organizations to do the same. It requires a unified effort, and we will play our role. We will play an active role in supporting this high-level strategy, and we will do that by developing the practical tools that can be used on farm and continue to encourage excellence in biosecurity. Thank you.
Thank you so much, Julian. Karel, please.
Sure. Hi, thank you, Ismaili,
Go ahead,
and
please.
I'll keep it short too. I agree with many of the points which Julian just made. I represent Health for Animals, which is the Global Animal Medicines Federation, and thanks for the opportunity to talk today. The plan presented today, I think, makes some very important points and addresses those well. I was asked by you, Ismaili, if there are any quick wins. I fear not, but allow me to make 4 quick points. First, on biosecurity, and like Julian, and let me be very clear, a biosecurity-only approach has failed. I'm going to say it again, a biosecurity-only approach has failed. Increasing biosecurity is critically important, as Julian well pointed out, but for some production systems, it's simply not enough anymore. And they are calling very openly, so their national leaders, for additional tools, like vaccination. Second point, vaccination and surveillance. Now, vaccination obviously has huge benefits, but it has to go hand in hand with surveillance. And for this, public-private cooperation on surveillance is needed, given the difficulties for only the veterinary public services to fulfill all these surveillance tasks. So there needs to be working together on the surveillance point. My third point is on vaccine development. So my organization represents the majority, if not the large majority, of animal vaccine developers around the world. And our contribution, our responsibility is to invest and develop HPAI vaccines. And there are very, very many good, efficacious vaccines that exist and that are licensed around the world and in many countries. And just last week, a very large country announced important public spending for further research, which we certainly welcome. But I have to give a note of warning. Given all of the obstacles to vaccination in many countries, like export considerations, like cost, like lack of government planning, like lack of coordination between trading blocs, the incentive to continue to invest in innovative vaccines whose use is very limited to date, that is a challenge. My last point is that it is inexplicable, I think, that there are still countries who do not have, I'm saying this many, many years into the HPAI outbreaks. It's inexplicable that there are still countries and governments who do not have anticipatory disease management policies and systems in place. Now more than ever, governments with stakeholder input, we must dramatically increase forward-looking pre-outbreak planning, including finance. And thank you to FAO and WOAH, for this plan, because this plan contributes to that. So thank you for that. Can't hear you, Ismaili.
Karel, it's well noted. And let me go to Nicolo quickly, because we are really very late. Sorry for Nicolo. Sorry. Yeah, please.
Thank you, Ismaila. And IPC, on behalf of the global poultry meat sector, welcomes the revised GFTAD strategy, and we are thankful to have had the chance to contribute to the drafting process. I align with my colleague on most of what they said. I want to underline the key role of collaboration between the public and private partners at global, regional, and national level, also considering how this disease has evolved in recent years, going beyond the poultry sector alone. So I'd love to see this collaboration growing in the future. So So a quick win is to ensure that everyone are sitting around the same table, collaborating, communicating, and leading, building upon the elements within the plan. We need a true holistic approach to systems, from prevention intervention to surveillance, to biosecurity, to trade, to consumer confidence. The success in preventing and controlling AI will depend on how we leverage our roles and resources as we look about policy, international standards, and particularly which actions are needed. As Karel said, there is no silver bullet and there is no one-fit-all solution. The poultry meat sector is highly committed at all its stages to play a key role in preventing and controlling AI, and its support to the implementation of the strategy is at total level. We recognize that intervention tools, such as vaccination, could play a role in containing viral spread, only as part of a broader strategy which includes biosecurity, flock health management, and effective surveillance. But we also strongly and firmly advocate for intervention to not have an adverse impact on trade if performed under WOAH standards, considering the pivotal role of poultry meat production and trade in food security. We strongly encourage countries and regions to abide to the spirit and the words and the letter of WOAH's terrestrial code by adopting mutually recognized zones and compartments, everything with the deepest respect of each country's international debate, process, and decision. We look at international organizations such as WOAH and FAO and their policies to provide strong leadership and to drive joint efforts. So we commend GFTAD on the revised strategy, which we believe is a solid first step towards a successful prevention and control of this virus globally. I hope I was short enough.
Yeah, thank you so much, and that will show really how the private sector is engaged really to support the implementation of this strategy. That's really very important. We see all the issue and challenge and the win you share with us. That's a good point. It's well noted. I would like just to inform that many discussion is now ongoing on the chat, and thanks to the colleagues to addressing them that one. And we will try to address them as soon as really we are going to explore and digest all the communication in the chat. Now we are at the end of our session and would like really to introduce Dr. Montserrat Arroyo, Deputy Director General International Standard and Science, co-chair of the GFTAD Management Committee from WOAH, to activate her mic and video, and Dr. Madhu Dhingra, Head of the Emergency Prevention System for Animal Health and members of the GFTAD Management Committee from FAO. Now we are at the end of our session, and as you, yes, we are at the end of our session, and as you can see, the strategy was, the vision, the goal was presented, the process was presented, the challenges from the two institutions was also shared. You hear from our representative from the regional economic communities, the countries, the private sectors, the other institutions. We would like now to really hear from you as members of the GFTAD Management Committee. The vision, the governance, and the coordination you think can help really to support the implementation of this strategy. I will start with Dr. Montserrat to really give us your feedback on that one, and after Dr. Madhu Dhingra, and at the meantime you will share your closing remarks. Please.
Thank you, Ismaila, and I appreciate everybody for the preparation, and particularly not only the panelists, but everybody participating to this webinar, which is key for the implementation of the global strategy. So it's been very rich, and I think what we need to do is focus on what's next. How is this strategy going to be implemented? And one thing I heard about consistently through the webinar was this need for regional adaptation. And that is why I think we do need to continue working regionally through the GFTAD's regional steering committees and use the guidance of the standing group of experts, which have already been formed for avian influenza in different regions, so that the global strategy can be adapted to fit each region's unique circumstances and while continuing fostering the One Health collaboration to further support our members to implement their national action plans for HPAI. One thing that it was also shown is that we already have several tools that have been developed by OFLU, by FAO and WOAH, as well as other organizations and institutional and research institutes that support us in the activities that are already describing the global strategy. So let's use them, let's adapt them, and let's improve them so that we can really achieve this control and prevention of HPAI within the next 10 years as the global strategy it's considering. Thank you, Gunalan.
Thank you. Thank you so much, Dr. Montserrat.
Oh, sorry, Ismaila. I was looking at Gunalan in the
Okay. Let's give now the floor to Dr. Madhu Dhingra.
Thank
Madhu,
you.
the floor is yours.
Thank you, Ismaila. And first of all, a very heartfelt thanks to all the panelists, all our presenters. It was really nice to hear all your insights. And, we heard that this is a very complex challenge. FAO and WOAH have done their part. But I think now it is over to all of you. And we heard that the role of the regions is very important. The regions need to take the leadership. They need to take the strategy, contextualize it, adapt it to their situation, and really find their solutions. And I think the word that is key here is these co-created solutions. There is no one-size-fits-all approach. So the solutions have to be fit for context. They have to be fit to the region that you are in and the different countries within the regions. FAO and WOAH will support you in this endeavor. Our role is to provide you the best possible tools. Our role is to bring you the experience from the different regions. There are regions which have managed to deal with this disease for a long time. So what are the lessons they've learned? What are the experiences that they have, and bring those to you. But as we also heard, we've got a lot of tools in our arsenal. Biosecurity is one. Vaccination is another one. Policy innovations, we didn't talk a lot about that. Controlling avian influenza needs policy innovations at national level. How do you create that policy environment that incentivizes change at the primary producer level, at the value chain level, to make sure that all the sectors that are involved in avian influenza discuss the trade-offs and benefits and find the solutions that fit them. A One Health approach is key. So I think addressing the upstream drivers and multi-sectoral, multidisciplinary collaborations are really important at national level. Also at global level for data sharing. We have a lot of data, but we are not leveraging it. We're not bringing it together for the solutions that we need. So there's a lot of work for us to be done, and FAO and WOAH with you together in this journey. 10 years is not a very long time. If I had a crystal ball, I looked forward, the world would be a much better place. The poultry sector would be more resilient. The public health sector would be safer. And that's the vision that we need to work towards. And biodiversity would be safeguarded. So I think there's a lot to be done, and we look forward to working with you in taking the strategy together forward. Thank you very much, everybody.